सर अब आप लाइव हैं?
Sir, got it.
A very good evening to all of eminent doctor. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Kerala through innovation to serve the society and humankind. The topic of webinar is novel 3-dose G protein vaccine, ultimate key for compliance. Dear Doctor, Travi is the world's first novel 3-dose anti-rabies vaccine. And with great pride, we would like to inform you that Travi has successfully completed 1 year of launch, with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded, and no case of ADR was registered. With this, it is my honor to introduce to the speaker of today's webinar, Dr. Prem Kumar, MBBS, MD. Now, I would like to request Dr. Prem Kumar to initiate the talk, and later on we have a question and answer session. All the participants can drop their question in the drop box, and we will read out all the questions after the presentation. So, sir, now I hand over the session to Dr. Prem Kumar, sir. Sir, now you can start.
Hello everyone, this is Dr. Prem. Welcome to all of you in this webinar of Thrivage, which is organized by very most reputed international companies, Cadila Pharma. Especially welcome to all seniors and my colleagues. Today we are participating for new invention of rabies vaccine by Cadila Pharma. First time in world, only 3-dose intramuscular injection. So let us we get स्लाइड आगे नहीं बढ़ रहा है. हेलो सर. स्लाइड Yes, let us we would like to give a information about the rabies. Globally, 59,000 human deaths annually, highest in India. Whenever India had 20,000 human deaths a year from rabies, according for 60% of the rabies deaths in Asia and 35% globally. 91% deaths in India occurred in rural area. So like this way, we can say in every 9 minutes, one person goes to death by the rabies. First of all, we would discuss about the current management. Previously, whenever we found out the bited person, the local wounds treatment should be used as a first aid. In the local wound treatment, first of all, we should clean out the wounds very clearly. We can say by the fresh water and with the help of soap also. It reduces the very chances of infection in our body. After cleaning the wounds, if the wounds is very hard, in that conditions, we should not use the suture. After washing the wound, we should use the vaccines, active immunization, and after that, passive immunization. Current challenges for PEP, non-compliance. Current rabies vaccines are cell culture vaccine. This is known as the CCV. And inactivated vaccines are always used after 50 years of age. In this anti-rabies vaccines complaint, who received the full course of ARV, that is the scheduled dose of ARV on the recommended dates. Delayed complaints who completed the scheduled dose of ARV with 60 days but deviated from the scheduled regimen. And dropout non-compliant who had taken at least one dose of ARV after animal's bite but not completed all the scheduled doses. Now we have discussed about the post-exposure prophylaxis in routine practice in view of the new Center for Disease Control and Prevention and World Health Organization recommendation. Retrospective analysis done at travel clinic, a total of 110 patients who received rabies 4-dose PEP, and shortcoming in the management of these patients were late initiation of rabies PEP in travelers, administration of human rabies immunoglobulin and antibody levels less than 0.5 interunit per ml in 6 to 90 patients. Non-compliance to 5-dose prevent cause of death. This is a very critical and tough challenge. It is painful also. So complaints to post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study at Safdarjung Hospital, New Delhi. Normally 360 animals bite patients, a pre-designed, pre-tested, structured questions was administered by the interview technique. Complaints to anti-rabies vaccination in post-exposure prophylaxis. The complaints rate for intramuscular rabies vaccination was 60%. Constraints for complaints to complete courses of anti-rabies vaccines. Interference with school timing 11%, distance of the hospital 11%, cost incurred 13%, and forgotten date 18%. Evaluation of rabies vaccines. First of all, we would also like to inform and remember to that great personality and great salute to that scientist who have discovered these vaccines. First of all, in 6 July 1885, Louis Pasteur have discovered these vaccines, and first time in 1885, these vaccines was used to Joseph Mister 9 years old boy. In that times, 13 vaccines was injected within 11 days. But after that, our scientists have researched this molecule, these vaccines, and upgrade and allowed to 1911. That time, 5 to 6 vaccines was indicated. 0 days, that means first day after exposure, 3, 3rd, 7th, 14th, and 28th days. And sometimes after 90 days, as the booster dose that was recommended, but 1976, the dose have once again corrected. And that time also 5 dose was indicated. But now these days, our company is very reputed and advanced. Cadila Pharma have innovated the only 3-dose vaccines. So we all doctors are salute to that company because this has very less pain, very easy schedule, and without forgetting, everyone can remember this one 3 dose, 0, 3, and 7. So we can say after receiving the 3 dose, first, second, third, we can get the totally free from the rabies infection. So now 3 dose, first protein summit vaccine prepared by VLP platform technology. After that, first vaccine with 3 dose intramuscular regimen, 0, 1st, 3rd, and 7th days. So it is better compensation to do to easy regimen and less risk, and always it is already and ready form. So no have need to extra water solution. Now this is the VLP technology, native virus, and also we want to give the information. First time this virus is discovered, and that is the rhabdovirus and Lysa virus. So this is the virus. Native virus is G protein. Is difficult to stabilize G protein isolation using VLP technology, purified and stabilized by Cadila Pharmaceuticals Limited. So VLP are similar to native virus particles, but that do not contain the viral genome. Virus-like particles, VLPs, are protein complex element and nanoparticles. So they are capable of introducing a strong humoral and cellular immune response. Now clinical phase study design 0 to 3 days and 037 3 dose. Safety and immunogenicity of a novel 3 dose recombinant nanoparticles rabies G protein vaccines administered as simulated post-exposure immunization, a randomized comparator control, and multi-center phase 3 clinical study. These vaccines also have a peculiarities. It should be used on the deltoid muscles only, not intragluteal. To evaluate immunogenicity and safety of rabies G protein vaccines administered as a simulated post-exposure immunization in healthy volunteers, randomized comparative controlled multi-centric study, total subject 800 immunization. So this is recommended only 3 days, 037 rabies. Now we would like to inform and suggest this is the very best vaccines, and first time it has discovered in India by the Cadila Pharmaceuticals. Only 3 doses is recommended, 1st, 3rd, and 7th days. For the prevention purpose, those persons are working in the forest and very near to the incidental like dog, cats, and fox, they have recommended only 1 dose. We will discuss about the results. The results were consistent across different age group and genders. Observed difference 1.52%, 95% clearance, 0.18% to 4.17%. Efficacy wise 110%, 90%, 70%. Safety profile is very high. We will discuss about study conclusion. Novel 3 dose was non-inferior to reference vaccine. Less adverse effect compared to reference vaccines. Novel 3 dose was found to be safe and immunogenic and was comparable to 5 dose of WHO pre-qualified vaccines. And about awards, our company, Cadila Pharma, Innovation of the Year, have got the 2 awards. Pharma Innovation of the Year by the Economic Times, and the Golden Global Tigers Award in Malaysia Innovative Product of the Year. So thank you very much. We have tried to give the information about these vaccines to all of our senior and the all colleagues doctors. Thanks,
Sir.
many thanks.
थैंक यू सर। मतलब स्लाइड के अलावे सर कुछ अपना क्लिनिकल जो
Sir.
एक्सपीरियंस है उसको शेयर कीजिए सर अबाउट रेबीज।
जी sir. Before we will discuss very past times before in the starting 1885 there was no any sufficient treatment and vaccines was available. In that days our most doctors was using like this पागल कुत्ते के बाल को घावों पे रख करके रोगी को पिलाया जाता था। Sometimes they use the hot and boiled mustard oil and boiled water for the killing to the virus, but there was not sufficient treatment. But now these days, if we will discuss before 15 years ago, 10 times 7 to 10 vaccines dose was injected in the umbilical cord surround the umbilical region. They was very panic and complicated. After some days, our scientists have researched and they have started to give the vaccines 6 to 7 dosage courses. First 0, 3, 7, 14th, 20th, and after that, after 90 days, they was known as the booster dose. Recently, our scientists have improved and they have started 5 vaccines, 0, 3, 7, 14th, and 20th. But we are feeling very proudful and glad to know that Cadila company have initiated and launched only 3 dose vaccines. This is very easy as the following and the totally painless. So we give totally thanks to that company. One certain matter is also here in the rural area, those doctors who are practicing in the rural area. So sometimes we fully care to the dog. If the dog is infected, if you know about the history of that disease, so first time bat was infected by this rabidovirus, and bats in bite to the dog, and like that mode of transmission is when dog in bite to the human beings through the saliva and some leakage of tears, the virus enter in our human skin and they directly infect to the central nervous system. So like this way we can say clinical sign and symptoms. We will discuss about the clinical sign and symptoms. The hydrophobia, there is no any certain type of such examination is for the detect of rabies infected person, but the clinical diagnosis, hydrophobia is a very common sign. That means hydrophobia, fearness from the water. If the patient comes suspected case with the rabies, the patient comes in the clinic. So in that conditions, if patient feel more thirstiness, but he is not capable to drink the water, he feared from the water. He feared from the water. In that conditions, we directly diagnose this person is suffering from the rabies virus. So I will told to you before 20 years, in 2000 years, I was the medical officer in Mission Hospital, Faridabad. 10 persons have come directly infected to the rabies, and all presents the same signs, same types of such signs. In that conditions, we have not taken the risk for the treatment. We have referred to the All India Medical Institute of Delhi. So, and 2003, we have also find out in my clinic, 2 persons have come, same such type of clinical sign. First of all, whenever we take the case history by the patient and by the attendant, directly they told to him, sir, we have we have bited by the animals like the dogs, and dog is the common animals, and 80 to 90% risk is by the dog. Or if we see the wound is very difficult and very typical, in that conditions, first of all, we should clean the wound properly. We can use the fresh water also by that, and we can use the soap also. ऐसा करने से 15 to 20% rate of incidence was reduced. The virus can be washed out and killed by the wounds. After that, we can also use the vaccines as the injectable subcutaneously around the wounds. They also reduce the chances of infection. After that, if the wound is very difficult, very tough, and wound is in large quantity, that should not be sutured, and we should treat by the antibiotic also with the vaccines. Sometimes patient in passive form, whenever we diagnose patient is 100% suffering from the rabies infection, we should treat, and we should watch the clinical conditions. Clinical conditions like high grade fever, severe pain in the site of biting, vomiting meliage, and hydrophobia, that is also present in that patients. So we should watch the all things. After that, we should start the treatment. This is the main facts regarding the rabies. Yes, sir. Or any other question?
सर
जी सर, बोला जाए।
थोड़ा सा सर, फर्स्ट ट्रीटमेंट क्या होना चाहिए अगर किसी को कुत्ता काटता है सर?
सर, किसी को अगर कुत्ता काटता है तो सबसे पहले हमें ये जानकारी लेनी जरूरी है कि देहातों में कुत्ता तो वैक्सीनेटेड होता नहीं है। अगर कुत्ता वैक्सीनेटेड है, उनके पास सर्टिफिकेट है वैक्सीनेशन का, तो वहां पर रिस्क हमारा बहुत ही कम हो जाता है। अगर कुत्ता वैक्सीनेटेड नहीं है तो हमें पहले फर्स्ट वीक ऑब्जर्व करना चाहिए कि कुत्ता कहीं मर तो नहीं गया। अगर कुत्ता मर गया, that means that directly indicates that was suffering from the rabies virus. If the dog is alive, कुत्ता मरता नहीं है, उस स्थिति में हमें इस बात को भी ध्यान रखना चाहिए कि कुत्ता ने किस तरह का बाइट किया। जस्ट लाइक वी विल डिस्कस कि अगर डॉग बाइट, साइट ऑफ डॉग बाइट इज हेड एंड नेक, दैट मीन्स द रेट ऑफ इंसिडेंस, डेथ ऑफ रेट विल बी हायर। यानी अगर किसी के सर पे और गर्दन पे कुत्ता ने काटा है तो उसका जो इंसिडेंस रेट होगा वो ज्यादा हाई होगा। अगर वो पैर में काटा है या मस्कुलर पार्ट पे काटा है जहाँ नर्व डैमेज नहीं है, तो वहां पर हम थोड़ा सा सेफ हो सकते हैं। अगर कुत्ता पागल नहीं है, दिस इज नॉट सर्टेन दैट एवरी डॉग्स आर कैरियर ऑफ द रेबीज वायरस, दिस इज नॉट सर्टेन, बट वी आर नॉट नोन, हमें यह जानकारी नहीं है कि वो रेबीज वायरस का कैरियर है या नहीं है। इन दैट कंडीशंस we should directly advise for the prevention purpose. Patients should advise for the vaccination. And vaccine के बारे में मैं बता चुका हूँ कि पहले, आज से अगर हम 30 साल पहले की बात करें तो एब्डोमिनल मसल्स पे, एब्डोमिनल वार्ड पे दिया जाता था। आफ्टर दैट आवर साइंटिस्ट हैव इम्प्रूव, 7 डोज का कोर्स आया जहां हम 0, 3, 7, 14, 28 और 90 रिकमेंड करते थे। उसके बाद 5 डोज रिज्यूम आया, बट अब तो बहुत ही खुशी की बात है कि ओनली 3 डोज, इसमें कोई रिस्क नहीं है, कोई टेंशन, कोई भूलने की जरूरत नहीं है। ये पर्सन्स कैन वेरी इजी रिसीव दिस वैक्सीन एंड वेरी लेस टाइम। 0 का अर्थ है फर्स्ट डे, एंड वी शुड यूज द वैक्सीनेशन विद इन 24 आवर। तो हम यही सजेस्ट करना चाहेंगे कि सबसे पहले हमारी घाव को प्रॉपर वॉश होनी चाहिए। आप साबुन से भी कर सकते हैं और नॉर्मल वाटर से भी कर सकते हैं। 10 से 15 मिनट तक वॉश करना चाहिए। दे विल रिड्यूस द चांसेज ऑफ डेथ रेट। अगर पेशेंट इन्फेक्टेड है तो उसका चांस का जो रेट है उसको काफी कम कर देगा। उसके बाद मुझे वैक्सीन के बारे में सोचना चाहिए। और घाव को सूचक नहीं कर लगाना चाहिए। दैट शुड बी प्रोपरली ट्रीट एज द वाउंड्स आल्सो। उसे एंटीबायोटिक की भी जरूरत है, उसे एंटी इंफ्लेमेटरी की जरूरत है, उसे विकप्लेक्स की भी जरूरत है, और घाव को सबसे ज्यादा वॉश एंड क्लीन रखने की जरूरत है, ताकि वहां पर अदर बैक्टीरिया वहां पर अपना घर बना के ग्रोथ न करे और वहां पर कोई सेकेंडरी इन्फेक्शन लीड न करे। एंड वी शुड आल्सो वॉच द क्लिनिकल साइन एंड द क्लिनिकल सिम्टम्स। लाइक पेशेंट को बुखार नहीं आनी चाहिए, पेशेंट को चक्कर नहीं होना चाहिए, पेशेंट को पानी से भय नहीं होना चाहिए। अगर पेशेंट को बहुत तेज बुखार आता है, चक्कर आता है, घबराहट होती है, वो पानी पीने से भयभीत होता है, और in some cases we have observed and we have seen कि जो behavior है that is directly change into the infected persons, that मतलब उसका जो behavior होगा that will act as the dog, यानी कुत्ते की तरह भौंकना, कुत्ते की तरह चिल्लाना और कुत्ते की तरह पानी को चाटना, मतलब जीभ से सक करना, मतलब ड्रिंक नहीं, they are fed from the drink, but sometimes we have seen वो पानी को चूसता है जीभ से, like the dog. So these all are the signs and symptoms which persons suffer from the rabies virus, rabies disease. Not we are calling the rabies. Rabies is the name of virus. Rabido, that has taken from the Greek word rabido virus. That and the virus positive organism is rabidovirus and the Lyssa virus. So हमें इन सारी बातों को बहुत ही बखूबी से ध्यान रखना चाहिए। At least 1 week, we will talk about the incubation period. इसका जो incubation period है, that is 3 days to 9 days, and sometimes it is very longer than the 4 to 9 months. 4 to 9 months. तो हमें इसके incubation period पे at least patient should be deeply observe up to 0 to 9 days कि किसी प्रकार का सिम्टम्स तो डेवलप नहीं हो रहा है, वाउंड की स्थिति क्या है, और कुत्ता कहीं मर तो नहीं जाता है। अगर इन सारी बातों को हमें ट्रीटमेंट के दौरान ध्यान रखना चाहिए।
थैंक यू सर।
यस सर, अगेन प्लीज।
सर बहुत अच्छा सेशन रहा, बहुत कुछ सीखने को मिला है। अगर किन्हीं का कोई क्वेश्चन है तो प्लीज राइट योर क्वेश्चन इन ड्रॉप बॉक्स।
एक चीज सर और करना चाहेंगे, रूरल एरिया में हम लोग देखते हैं जब भी कुत्ता काट लेता है तो गार्जियन उसको झाड़ने और फूकने वालों के पास भी ले जाता है। इससे बिल्कुल गलत बातें हैं। किसी भी प्रकार से यह मान लिया जाए कि झाड़ फूक से कुत्ते काटे हुए को ठीक नहीं किया जा सकता है। बट अभी हमने जिक्र किया है कि कुत्ता ने काटा, wounds appears on the body, but this is not certain कि rabies virus is present with the dog. In that conditions, if the virus is not present with the dog, in that conditions there is no chance of there is no any type of such chance and risk of the infection and infection of the rabies virus. तो उस तरह का जो कुछ केस है, झाड़ फूक वालों ने झाड़ फूक किया और रोगी ठीक हो गया, अदरवाइज कोई भी इसमें दूसरी सत्ता नहीं है। We should properly treat the patient by the doctor and the expert physician who have the lot of experience, who have the lot of knowledge regarding the rabies virus.
सर थोड़ा सा 5 डोज और 3 डोज, 5 डोज वर्सेस 3 डोज, थोड़ा सा कंप्लायंस बता दीजिए जो पेशेंट को क्या बेनिफिट है सर।
सर देखिए, जब 5 डोज की बात थी तो हम लोगों को रोगी को लिख के देना पड़ता था, कार्ड पे लिख के भर के देना होता। उनके पास एक सर्टिफिकेट की कूपन आती थी उसपे कि आपको फर्स्ट डेज इस डेट को 0, 3, 7, 14 and 28 days, and if the case is confirmed for the booster as the booster dose, यानी सुरक्षा के दृष्टिकोण से हम लोग 90 डेज भी रिकमेंड करते थे। वो थोड़ा सा पेशेंट के लिए जस्ट लाइक पेशेंट 50 किलोमीटर से आ रहा है, 100 किलोमीटर से आ रहा है, उसे हम 5 बार 7 बार क्लिनिक पे बुला रहे हैं, तो ऐसी कंडीशन में वो क्या करते हैं कि वो कभी कभी आना भूल जाते हैं और आते नहीं हैं आफ्टर due to great distance. But where we will discuss about the 3 dose, this is the very convenience. हमें पेशेंट को 3 दिन के बारे में बताना है कि आपको सिर्फ 3 दिन लेना है, 0, 3, 7। तो मैं समझता हूँ कि इट इज वेरी इजी फॉर द फॉलोइंग, समझने के लिए भी और पेशेंट को आने के लिए भी। और ये यहाँ इकोनॉमिकल सेव भी हम कर सकते हैं कि जहां हमें 5-7 वैक्सीन लेने की जरूरत थी, वहां पर हमें कम एक्सपेंसेज में हमें 3 वैक्सीन से काम चल सकता है. सो दिस इज अ वेरी कन्वीनियंट एंड वेरी इजी.
सर एक क्वेश्चन है, लास्ट क्वेश्चन. तो
Yes,
सर
sir.
अगर मान लीजिए कोई पीएचसी में गया और एक वैक्सीन ले लिया,
जी
अगले शेड्यूल में गया तो उसको वहाँ वैक्सीन अवेलेबल नहीं मिला,
जी.
सर उस कंडीशन में हमारा जो थ्रेवीज है वो 3 डोज लेना पड़ेगा या
नहीं सर,
उसका
ऐसा है
मतलब
कि
2 डोज लेना
ऐसा है
पड़ेगा
कि
अगर पेशेंट?
सर ये है कि पेशेंट शुड कीप द फुल अटेंशन एंड गार्जियन एंड अटेंडेंट आल्सो कि उन्हें वैक्सीन का प्रॉपर डोज और प्रॉपर डेट पे मिल जाना चाहिए. अगर बाय द वे विद इन 24 एंड 48 आवर्स अगर किसी ने सेकेंड डोज रियल टाइम पर नहीं ले पाया तो अपना सेकेंड एंड थर्ड डोज ले जरूर ले. दिस इज द नेसेसरी. दिस इज नॉट नेसेसरी कि अगर उसे 4-6 घंटा लेट हो गया तो कोई प्रॉब्लम की बात नहीं. जहां हाँ इस तरह की बातें जरूर है कि सपोज दैट वन पर्सन इज टेकिंग रिसीविंग द वैक्सीन फ्रॉम द अदर कंपनीज, अगर वो किसी दूसरे कंपनी का वैक्सीन यूज कर रहा है और उसे दूसरे कंपनी की वैक्सीन लेना पड़ा तो उनको उस शेड्यूल के हिसाब से चलना पड़ेगा. अदरवाइज देयर इज नो एनी टाइप ऑफ प्रॉब्लम. तो अगर 24 घंटा डिले हो जाता है तो ऐसा कोई क्रिटिकल कंडीशन अपियर नहीं हो सकता. दिस इज नॉट ए प्रॉब्लम. ले सकता है. अगर उसे पीएससी में
ओके सर.
सपोज दैट एक जगह नहीं मिला वो सेकंड पीएससी में जाकर के भी सदर हॉस्पिटल में भी जाकर ले सकते हैं. देयर इज नो एनी प्रॉब्लम. लेकिन उसे ले लेना चाहिए, ये भूलने की चीज नहीं. बिकॉज प्रिवेंशन ही इसका इलाज है, दूसरा कोई इलाज नहीं. क्योंकि जब पोस्ट एक्सपोजर में साइन डेवलप हो जाने के बाद देयर इज वेरी लेस चांसेस ऑफ क्योर द पेशेंट, जैसा कि हमने देखा है.
थैंक यू सर. सर now I want to close the session.
Thank you very much.
Thank you so much,
Or any
Dr.
question?
Prem sir. सर क्वेश्चन हम नहीं है.
Thanks, sir. Thanks
So,
for cooperation.
sir, thank you so much. Sir, thank you so much, Dr. Prem, to informative
I have tried. I have tried
truly
only.
appreciate your efforts.
Okay, sir. Okay, thank you, sir.
Last but not the least, we would like to inform you that Travis has won 2 prestigious awards in innovation category: ET India Pharma Award and Golden Globe Tiger Award, sir. So thank you, sir.
Thank you, sir.
Sir, now I want to close the session, sir.
Okay, thank you very much. Thank you, sir.
Okay.
And again, meet you. Bye.
Okay, sir. Please,